And
Okay.
Rebecca's going to start with the presentation.
And I don't know that I've met either of you either. I'm Rebecca Havan, the Dean for International Studies. So I'm going to share the PowerPoint that we're going to be following. So hold on a second. Okay. And just jump right into sort of the first slide here, which is to share a little bit about our decision-making around study abroad and the process that we went through of approving which programs we felt we could support for this year. And we, you know, we have been dealing with this now, obviously, for, gosh, over a year. And last summer, we were guided to form a risk group called the Study Abroad Risk Assessment Advisory Group, SARAG. And this group has been meeting almost weekly for the past year, following the COVID transition rates and then recently the vaccination rates in every country. And the scope of the work was really to, you know, determine what are the critical factors that we need to look at in assessing COVID risk and what precautions need to be in place in order for us to resume academic study abroad. So it's been a good process with several faculty and our Dean of Students and the 5 college risk managers. And the guiding principles of this group, which were really helpful to have in mind as we started, were that first and foremost, your safety and welfare is of our primary concern, as well as that of any faculty or the host community, that every program has an excellent academic structure, obviously, but most importantly, a capacity to pivot to remote instruction should an early departure be necessary, or even in country if there are pandemic conditions where there's a lockdown, for example, that you'd be able to continue remotely. It was also important that cultural immersion and intercultural learning was going to be possible. We didn't want students to be in a situation with a lockdown where there's like, what am I doing? I might as well be home, or, you know, I can't even go out on the streets. So we were really looking hard at whether going to a country in a situation where that was possible would be worthwhile in terms of the goals of study abroad. And then we also were able to think about how the Smith culture of care principles could be integrated into what we were looking at, and in particular issues of equity, inclusion, and flexibility. Were we being fair with each of the situations that we were approving around students being able to participate fully? So that was a lot of the initial conversations around how we would guide our work. And then I'm going to go through the specific criteria that we actually looked at and measured, what we called our Tripwire Metrics, whether we would approve a study abroad program or not. Because to be honest, most of the sites were not approved. It was really a handful of sites. Well, now more than a handful. Last year it was a handful. Now we've got, I forget what, 20-some sites that we've approved that we feel confident about. First and foremost was, can you even get there? You know, can you get a passport? Can you get a visa? Was that going to be an obstacle? And then were there restrictions? So certain countries, New Zealand, for example, you can't even get in there. Not even New Zealanders who are stuck outside of New Zealand could get in for a long time. We looked at the Department of State warnings, which of course have been kind of fluctuating over the last few weeks, which has been an interesting journey. The Centers for Disease Advisories also. We looked at really also through the U.S. Embassy information and other information in country, what the conditions of healthcare systems and facilities were. Because you could be in a country, not have COVID, but there could be a raging pandemic, and all of a sudden you're having another medical issue, and it might be difficult to get healthcare. So accessibility to healthcare was an important criterion. We wanted to make sure every program had a published contingency plan, and that we felt confident about that and how they would handle a situation if it came up, especially around student health and safety, and if you were sick, what their testing protocol was, or evacuation plans, etc. And as I mentioned earlier, did the plan provide for academic continuity? So if there's any disruption, we want to make sure that you can complete a full academic semester. We have been looking especially at independent travel, and the reason for this is that in a lot of countries, what we were seeing over the last several months is that borders would close suddenly. So if a program was allowing weekend travel, what if you're in Spain and you decide to go visit your friend in the UK, and literally that weekend they decide to say, guess what, nobody from the UK can come into Spain. And that was happening. People were getting stuck out of the country. So we were really looking at whether that was a concern that the programs had taken into account. And then also the financial risk. Even though we have a homeschool fees policy, we wanted to make sure that programs were refunding deposits or even not charging until literally day of arrival, and that there was minimal risk to the college in terms of approving the program, because we needed to make these decisions several months out. So this was a very thorough process, and it was a really great team of people, again, going through this over and over and over and monitoring changes to any of these. And I'm going to turn it over to Lisa now to talk about what it actually means. And Lisa, just let me know when you want me to do the new slide.
Sure, thanks. So the next topic of this presentation is and was deeply connected to what Rebecca has just described in terms of the criteria we were using is, what does it really mean to study abroad during a pandemic, and what would be the study abroad experience for the students while they're on the ground? And so we were asking ourselves, how we're going to manage uncertainty regarding the changes in the pandemic and the trends, the local public health guidelines. We were also particularly concerned that we didn't want study abroad students to necessarily be a burden on the local health system if that local health system was in crisis or was already maxed out, right? We saw this in the US, with certain cities where the hospitals were at capacity. And so we wanted to make sure that our students could get healthcare should they need it, but then also not to add on to a crisis that was already in existence and stuff. Again, we were looking at what happens if local courses were to be scheduled to start remotely. We actually weighed against this one because we didn't want students to be studying abroad from their childhood bedroom at home in Iowa, for example. I don't know. We wanted to make sure that students were going to have, as much as possible, an immersive, intercultural and academically enriching opportunity. So that was one of the things that we were looking at in terms of moving pieces. Like I said, local public health guidelines. We had quite lengthy conversations about whose guidelines are we going to follow? Are we going to follow the Massachusetts guidelines, or are we going to follow the local guidelines? And in terms of masking and social distance, and even conversations about the distance of social distancing. Is it 6 feet? Is it 2 meters? Is it 1.5 meters? We had quite a lengthy conversations with that. We opted in that area to go with whichever guideline was the stricter and stuff. And so in some instances, the Massachusetts and the Smith guidelines, Smith campus guidelines were more strict than the local ones, and vice versa. So again, try to create as much assurance as possible that we're keeping our students safe. That was the decision around that. How isolated would you be in your living experience? Again, it's one thing to get there, but then as Rebecca said, if the country goes down on lockdown, are you in your room and not being able to go out anywhere. You know, some of the countries in Europe were quite strict about their lockdown and shutdown requirements. And I know in Spain, you know, they had to get permission to be able to go to the supermarket and stuff like that. Well, while that is in and of itself a cultural experience, not quite the one that we're looking for our students, right? And then, you know, the last point is quite evident, you know, resulting in your experience that meets our vision of study abroad as well as your vision, right? Cultural experience, academic, enriching academic opportunity. And then how well would that fit into your own overall plans and stuff? The next slide. So similar, we took an approach similar to what the college did, and looking at levels and stuff, and trying to guesstimate where the different destinations where the students would be landing. And Rebecca and I were commenting on this because we did a similar presentation about this last fall. And last fall, we were in most restrictive. And most countries where you're going to get there, you're going to have to quarantine for 14 days. There may be a curfew, and by which you need to be back home by 8 p.m. You know, all instruction is remote and no independent travel. I think fortunately today we're not there. I feel like we're probably more in the more moderately restrictive, even here in the U.S. And then we're seeing this abroad as well. You know, quarantine times are reducing from 14 to 7. If people are fully vaccinated, they may not even have to quarantine. You know, and so we're seeing that with different countries and stuff. I haven't seen much in terms of curfews being implemented in this moderately restrictive, but I don't have a handle on all 20 destinations exactly with that. We're seeing a lot of multimodal instructions where there could be some in-person components to your classes, as well as some remote opportunities as well. So a mixture of that, which is something that we're looking for and we're happy to have. And then we're seeing with countries limited independent travel, most of it within the host country. So again, like Rebecca said, not a lot right now of independent travel internationally because there's still the risk of border closures. But as long as local guidelines are allowing, the programs are limiting, you know, independent travel within that country and stuff. So that's good. You know, that's getting much closer to, you know, the study abroad experience that we're hoping for Smith students. It's possible, we're crossing our fingers, that between now and September, you know, we'll be a little bit closer to the least restrictive mode of things, you know, as things continue, more people get vaccinated and stuff. And so if COVID has taught us one thing, you know, we need to hope for the best, but also plan for the not so best, right? So I feel in my role that while I like the fact that things are improving and stuff, I feel that there could still be a chance that things will go in the other direction. I'm hoping it doesn't, but we've set things up, you know, in such a way that we're able to pivot and support our students should they deteriorate. Again, I'm hoping that won't happen, and we'll continue to go towards more the green level and stuff. Okay.
Next slide.
Yes, please. Sorry. So is this my slide, Rebecca? I can't remember. Sorry.
I'll
talk about it.
Yes, it is. Yeah.
Okay. Sorry about that. Yes. So once we did a bigger, broader analysis of the study abroad locations, program providers, what they were providing and stuff like that, we narrowed things down. And Rebecca has mentioned, we talked about our COVID Tripwire metrics. And what we're looking at specifically on a weekly basis right now are the test positivity rate over a 7-day and a 14-day period. And as Rebecca mentioned, we did have to withdraw support from programs and countries in which this test positivity rate was almost double the percentage that we wanted it to be in. We wanted to be less than 10%, and we were seeing countries still in the 20% range, which was just something we didn't feel comfortable with. Number of new cases over 7-day rolling average, as well as per 100% population, and the trend of new cases, if it's on the increase or on the decrease, or is it retaining the special. What we're seeing, I think, as well, which is also happening here, as more people get vaccinated, there's still new cases of infection, but the age range is changing a little bit. And so that's something that we're also starting to pay attention to a little bit more closely. And then vaccination rates. Every country is different, and every country has different levels of resources and infrastructure. And so while we may not necessarily be expecting the host countries to be at the same level at the US, we do want to see a progression of improvement, more and more people being at least having their first dose, if not their second dose, and then how does that compare to as well their population. So as long as that trend is on the increasing and stuff like that, that we're feeling fairly confident with it. Next slide, please.
Okay, yeah. Now I'm going to speak a little bit about the risk waiver that you received, called the COVID Travel Advisory Form here. I think that you should have gotten this with some of your notification confirmation materials. This is an example of the one from France. There's a couple things on this form, which is the 3-page form, that I really want to draw your attention to, because it's important for us that everyone going abroad is aware of these issues. And first and foremost, on the second page, there's a whole section on COVID. There's so much that is outside of our control and it's uncertain in every country. But there could be an outbreak, even in a country that we deem safe right now. There can be a localized outbreak, and so it's important to know that we can't guarantee the screening for COVID or treatment or evacuation. We can do our best to try to provide it, but some of that might be out of our control. We really want to make sure that anybody with pre-existing conditions knows that you might be at higher risk for COVID infection, and to please consult with your medical professional in order to take that into consideration. Do you need additional meds or prescriptions, or just precautions that you need to take? Another issue that we have had to wrap our heads around is that, especially as the whole pandemic started last year, that if you become ill with COVID, you may not be able to travel home while ill. It may be difficult to get a flight home, to be able to get on, because you have to be tested for it, or to get on an airplane mostly. We do have some travel insurance that now has said they might be able to fly somebody to a place where they could get better medical care, but it may not be to your home. And what is likely going to happen if somebody does get become ill, is that they would have to be socially isolated. And so that's something that also we wanted to make sure everyone is aware of, that could also affect your experience if you need to spend 2 or 3 weeks in social isolation while you're infectious. And then just again, the reminder of what Lisa said, that we're not in Massachusetts. The places that you're going to go to don't follow our guidelines. They're going to follow whatever the local public health guidelines, and that may impact a lot of different aspects of the program: classroom instruction, housing, public transport, etc. So we want everyone to be aware of that. So those are the real highlights that I wanted you to be aware of when you sign that form, that it's, we have an obligation to share this with you so it doesn't come as a surprise once you're in country. I think I turn this back to you, Lisa. FAQs.
Sorry, I was still on mute. So the other thing that we've all learned through the pandemic, right, is being able to try to predict answers. Well, what if, right? And so some of the questions that might be on your mind or your parents' mind and things like that is in terms of reimbursement of costs. So as Rebecca mentioned, we did our research in terms of the destinations where students are going and have confirmed that the program providers have refund policies that build in the contingency of COVID and things like that. If we have to suspend approval for study abroad, and if you had to pay for your visa fees, the college will reimburse you for that. And we will also cover any required language testing or university registration fees that you may have invested in. We will reimburse you for that. For airfare, we will reimburse up to $300 for a change or cancellation fee. So we are encouraging students to really try to buy flexible tickets as much as possible. We recognize that those tickets are a little bit more expensive than some ones that are fixed date with no change, no change options or things like that. But again, in today's world, I think that we need to invest in a little bit pricier airfare so that you have some flexibility with change fees or cancellation fees. So we will cover up to $300 for that. And we're hoping, that although the students did register for fall semester classes and participate in room draw. And the reason for that, again, is we want to try to have a solid plan B should we be in a position to have to suspend study abroad. So we don't want to leave students without any options because that decision could come middle July, late July. We're hoping that by mid-August, we won't have to make any decisions or updates and stuff, but we still reserve that right because, again, we're not going to knowingly send you into a high-risk situation. And as Rebecca said, we're monitoring these situations on a weekly basis. So and interestingly, what we've learned too is you can kind of see trends ahead of time. So we'll know if something's starting to go in the wrong direction and stuff, and alert students accordingly and so on and so forth. But we still do want to reserve the right to not send you into a high-risk COVID situation and stuff. And then as you would have noticed in your approval notification, just a friendly reminder here that all students studying abroad will be required to be fully vaccinated prior to departure. We will likely be using the college's system with you sending your vaccination records to the health center. And then I will be requesting some release approvals from students. Nothing to worry about right now unless you haven't started your vaccination process. More information about this will come out in July. And that is kind of it for the presentation. And we don't know if you have any questions or concerns. Let me know that you're in compliance with the college's cultural care. And that is about it in a nutshell. So I'm going to stop sharing now and see